Welcome to our meeting titled Scaling Up the Protection, Promotion, and Support to Breastfeeding During COVID-19. My name is Darlene O'Meara. I am the Family and Community Health Advisor for PAHO in the Barbados and Eastern Caribbean Countries Office, and I am going to be your moderator this afternoon. This meeting is organized in the context of World Breastfeeding Week, which is celebrated every year from August 1st to 7th since 1992. As this is a global campaign to raise awareness and to galvanize action on themes related to breastfeeding. During the next hour and a half, we will be discussing important topics around breastfeeding, such as the benefits of breastfeeding and COVID-19. We would also hear about the country's experiences in promoting and protecting breastfeeding. And we're going to hear a bit on the topic, what the theme this year for Breastfeeding Week, as well as 2 testimonies on breastfeeding experiences. At this moment, during this seminar, we are expecting that at the end of this seminar or of the meeting, we will come out with a renewed commitment to protect, promote, and support breastfeeding in our countries from whatever position we sit, and to contribute to reach the SDG goal of at least 50% of children under 6 months exclusively breastfeeding. We've structured this meeting. We have 4 main presentations and 2 testimonies. After this, we'll be taking questions and comments. Please feel free to put your comments and questions in the chat box, or if you prefer to do it verbally, then please raise your hand so we could give you access to the microphone. As for now, kindly note your microphones are muted. So to begin this meeting, I will ask Dr. Yitades Gebre to please unmute his microphone and share with us his opening remarks. Kindly note Dr. Gebre is the PAHO WHO representative for Barbados and the Eastern Caribbean countries. And from his various positions and work in various countries, he's always been a strong advocate for breastfeeding and for women's right to breastfeed. So Dr. Gebre, please proceed.
Good afternoon, Dr. O'Meara, and good afternoon to you all. Thank you for being here. It is my great pleasure to welcome you all, Ministry of Health officials, partners, speakers, and colleagues. This is a very important period in our lives since COVID-19 pandemic. Breastfeeding is the foundation of child survival. In the past epidemics, health systems have struggled to maintain routine services, and utilization of services has decreased. We know that people, efforts, and the medical supplies all shift to respond to emergencies. At the time of COVID-19, this has also happened, and especially where there is disruption of the health services, over 50% of the services have been impacted. WHO recommends that mothers with suspected or confirmed COVID-19 should be encouraged, the same as all other mothers, to initiate or continue to breastfeed. Mothers should be consulted, counseled that the many benefits of breastfeeding for newborn babies and children substantially outweighs the potential risk for COVID-19 infections. For this, the experts will share with us what is known from the scientific literature. Mothers and infants should be helped to maintain and remain together while rooming throughout the day and night, and to practice skin-to-skin contact. I think this is the practice which we know. Breastfeeding women should be supported by giving them also breastfeeding breaks, necessarily from their workplaces. Nevertheless, more still needs to be done to realize this important intervention at the workplace. The protection and promotion and support of breastfeeding before, during, and after emergencies is a task for all of us, including at the time of the COVID-19. We continue to promote, protect, and support breastfeeding in the context of COVID-19 amid ongoing misinformation of the transmission of COVID-19 through breastfeeding. There is sufficient, reputable scientific evidence that all mothers, including mothers who have COVID-19, can still breastfeed their children safely.
For this meeting, we clearly heard your call to continue encouraging women to breastfeed despite the current situation. And our next speaker is going to actually speak more into this. Our follow speaker is Ms. Dr. Audrey Morris. Dr. Morris is the PAHO WHO Regional Advisor on Food and Nutrition. And Dr. Morris has been actively involved in the support provided to the Eastern Caribbean countries in implementing breastfeeding activities, such as the training of trainers for health workers. She has been revising various policies and guidelines that the region had been developing. And Dr. Audrey is also a member of the external assessment team for the Eastern Caribbean countries and Barbados. And Dr. Audrey will be speaking to us on the benefits of breastfeeding and also breastfeeding and COVID-19. So Dr. Morris, please take the phone. And
thank you very much. And yes. Can you hear me?
We're hearing you very well.
Okay. All right. So I'd like to thank you very much for inviting me to participate in this webinar. And it's very important that at this time, we continue to remember the benefits of breastfeeding, even though we are in a pandemic. And I'm just going to go through just the relevant, well, not that they're all not relevant, but I'll break it down for you why we should be all encouraging and supporting mothers to be breastfeeding at this time. So the next slide, please. These are the WHO recommendations for infant and young child feeding. So we would say that these are the standard infant feeding guidelines. And these guidelines are that breastfeeding should be initiated within 1 hour of birth. The child, the baby, should be exclusively breastfed for the first 6 months of life. And we know the meaning of exclusive breastfeeding, giving the baby nothing else except breast milk, no water, no other feeds, only medicine if prescribed. Following the 6 months, this should be followed by timely, adequate, safe, and appropriate complementary feeding. And during this time also, breastfeeding should continue for 2 years or beyond. Now, the facilitating factors, particularly in terms of initiating breastfeeding, are early and uninterrupted skin-to-skin contact between the mother and the newborn. So that skin-to-skin contact means that after the baby is born, within 5 minutes of birth, the baby would be placed in skin-to-skin contact with mother, so placed on mother's chest, with no clothes separating them or no blanket. They can be covered with a blanket as the room may be cold, but nothing separating them. And that contact should be maintained for at least an hour. During that hour, all that needs to take place in terms of the mother's needs and the needs of the newborn would need to be factored in, that should take place after the hour. What can be managed while they're lying there is fine, but otherwise they should be allowed to remain undisturbed for that hour. During that hour is when breastfeeding usually is initiated. Another facilitating factor is rooming in, and that means that the mother and baby remain together in the same room. They are not separated. In the Caribbean, we are quite good in terms of rooming in. There's also kangaroo mother care, which facilitates breastfeeding, and that's particularly for the very small babies or preterm babies. Next slide. So that's the standard guidelines. What happens when the mother has COVID. Can you go back, please? When mother is suspected to have COVID-19, or even if the child is suspected to have COVID-19, the recommendation is to feed according to the standard infant feeding guidelines. So those same guidelines that I just mentioned, they remain even during this time of COVID-19. What is added, however, is the infection prevention and control measures that the mother needs to take. So she will use the medical mask, she'll practice good hand hygiene, washing hands or using a sanitizer, and she will disinfect surfaces. If the mother is unable to directly breastfeed, there should be expression of the milk, so she should be supported to express her milk, and that milk should be fed to the baby. The mother and infant should not be separated, and skin-to-skin contact or kangaroo care should continue. There seems to be a timing issue with that slide, but let's move to the next one. Next slide. Okay, so what I described there, the scientific rationale for all of what I just said, is that the proven health benefits of breastfeeding must be weighed against the potential risks from COVID-19. Now, the research that has been done has found that the active virus has not been found in breast milk to date, and there is no vertical transmission, mother to child, documented. On the other hand, the antibodies and bioactive factors in the breast milk may fight against the COVID-19 infection if the baby is exposed. Additionally, infection of infants with COVID-19 has been very rare, but those children who get infected typically have very mild illness. So what has happened? The WHO has taken everything into context, and hence the recommendation that, having weighed everything together, the protective properties of the breast milk, and the fact that usually the infection is not, it is a mild illness. The active virus has not been found in breast milk. With all of that, they recommend the standard infant feeding guidelines should prevail. Next slide. And this is just a few of the benefits of breastfeeding in terms of protection. So we know that breastfeeding and breast milk protect against morbidity and mortality due to infectious diseases. The protective effect is particularly strong against infectious diseases that are prevented through direct transfer of antibodies and other anti-infective factors, and the long-lasting transfer of immunological competence and memory. And here is a very good reference for the clinical management of COVID-19, and there is particular attention paid in that for care of the mother and infant. So you can refer to this reference. Next slide. Some other sources of information that I'm sharing with you. There's a scientific brief on breastfeeding and COVID-19, and this is as late as June 2020. And all of this looks at information collected up to May of this year. So it is very current. And so this scientific brief is a very good source of information outlining what I have shared with you. There's also a set of frequently asked questions, FAQs, for healthcare workers. And what I'd point out to healthcare workers among us is that there's a decision tree that helps in making the decision, guiding you through how you can support the mother and the infant. Next slide. Other information, there's an information note. You see that on the left there, and that is prepared by PAHO. So that's information about breastfeeding and COVID, sharing with you some very good information. And you should have seen circulating the several social media cards, which I invite you all to share when you receive them, pass them on to others in your circle. Next slide. In supporting breastfeeding, I remind you that one of the very important tools, initiatives that we have is the Baby Friendly Hospital Initiative. And the BFHI creates an enabling environment for breastfeeding, including having the policies and guidelines that underpin the quality standards for promoting, protecting, and supporting breastfeeding in maternity facilities. And so PAHO continues to support countries in implementing the BFHI. Several of the Caribbean and Eastern Caribbean countries are already implementing BFHI. Next slide, and this is the last slide. The international code. And the code really, it governs how breast milk substitutes should be promoting. And why I'm sharing this particular slide with you is because we know that in a time such as this, breastfeeding is under threat from some unscrupulous persons and some who are uninformed. But as we promote breastfeeding, we should ensure that the use of breast milk substitutes is not allowed to proliferate, so that companies should not at this time be making donations. Governments and health facilities should not be accepting donations of breast milk substitutes. We continue to promote breastfeeding. And that's my information that I'll share with you for today. Thank you very much.
Thank you so much, Dr. Morris. You are very, very clear in stating that there is no evidence, and I repeat, there is no evidence that COVID-19 is transmitted via breast milk. I think this came out very clear, and you also shared with us some references, documents that we could use to support this statement. You also provided some clear guidance as to what mothers that suspect they are COVID-19 or maybe COVID-19 positive, some of the guidance what they could implement to continue breastfeeding. So we take good note of those guidances. And at the end, you made a call for countries to remember the code. The code is very important because at this particular time, we know that the milk substitutes are being promoted and might jeopardize many of the gains we have so far. You spoke also of benefits, and you spoke about the benefit to the mother, to the child, but our next speaker is going to share another benefit that we don't commonly promote, and but it's an important benefit that we need to take in account when we are promoting breastfeeding. Our next speaker is Miss Irma Mimi Chavarria de Massa. She's better known as Mimi, and she likes to be called Mimi. Ms. Chavarria brings experience of over 30 years working on various breastfeeding programs. She worked as a volunteer for the La Leche League International, which is a breastfeeding support group. She worked with various ethnic groups, and she served as an International Board of Lactation Consultant Examiner. She was appointed to represent the Latin America and the Caribbean region on the World Alliance for Breastfeeding Action, WABA. She's on the steering committee since 2012. Her studies are in food security and nutrition, and she's currently working with the World Food Program in Guatemala. Ms. Chavarria will be presenting us the framework for understanding the linkages between breastfeeding and planetary health. Ms. Chavarria, please proceed.
Good afternoon, everyone. PAHO WHO authorities, Ministry of Health authorities, healthcare workers, community leaders, and general public connected to this seminar. Greetings from WABA. On behalf of WABA, I want to thank PAHO WHO Barbados for the invitation to share the World Breastfeeding Week 2020. Support breastfeeding for a healthier planet. Next slide, please. The World Alliance for Breastfeeding Action, WABA, was formed in February 1981. WABA is a global network of individuals and organizations dedicated to the protection, promotion, and support breastfeeding worldwide. WABA coordinates the Global Breastfeeding Week campaign that aims to inform, anchor, engage, and galvanize action on breastfeeding and related issues. Since 1960, we have aligned our World Breastfeeding Week campaign to the United Nations Sustainable Development Goals, the SDGs, called the World Breastfeeding SDGs campaign. Next, please. WABA clustered the UN SDGs into 4 thematic areas that relate to each other and to breastfeeding. These areas will be celebrated in cycles on 2029. 2030 will be about taking stock of our progress and planning for work beyond the SDGs. World Breastfeeding Week 2016 made links between each one of the SDGs and breastfeeding. In 2017, we emphasized the importance of working together across all SDGs. In 2018, cemented feeding as the foundation of life. 2019 focused on supporting parents. To be empowered is vital in order to realize their breastfeeding goals. And this 2020 highlights the links between breastfeeding and planetary health. Next, please. So, World Breastfeeding Week 2020, the interconnected nature of people and the planet requires that we must find sustainable solutions that benefit both. We can reduce our carbon and ecological footprints, starting with how we feed our babies. We know, and Dr. Morris mentioned, that breastfeeding is one of the best investments in saving infant lives and improving the health, social and economic development of individuals and nations. Protection, promotion, and support of breastfeeding are all important strategies, and we have to collaborate with actors within, beyond the breastfeeding movement. Next. So the objectives of this year will be to inform people about the links between breastfeeding and the environment, climate change, to anchor breastfeeding as a climate smart decision, engage with individuals and organizations for greater impact, and galvanize action on improving the health of the planet and people through breastfeeding. Next, please. So we have challenges. Of course, we have challenges. Climate change and environmental degradation are some of the most urgent challenges facing our world today. Our food production systems and consumption patterns are significant contributors to climate change and environmental degradations. Next. So, the planetary health needs sustainable action. Depletion and destruction of natural resources and an increase in the emission of major gases are at the highest levels for at least the past years. Millions of years, it's not only few years. If we talk about emerging trends in global health and nutrition, although there have been many advances in global health in the past few decades, there are several emerging challenges. For example, natural disasters, infectious diseases, outbreaks, such as the ongoing COVID-19 pandemic, as well as a lack of adequate health systems. Food production contributes to about 32% of the global soil acidification rate and 78% of the over-mineralization of water bodies. Next. If we work in the scaling up, optimal breastfeeding could prevent more than 823,000 child and 20,000 maternal deaths each year. Not breastfeeding is associated with lower intelligence and results in economic losses of about $302 billion annually. Only about 40% of all babies born annually are exclusively breastfed until 6 months, and 45% continue any breastfeeding for up to 2 years. Often there is a lack of support to breastfeeding, whether in the health system, workplace, or community. Next, please. So direct breastfeeding and hand expression of breast milk are efficient in terms of reducing waste and saving energy and other resources. On the other hand, dairy farming typically releases substantial amounts of methane. Additionally, the manufacturing, packaging, distribution, and preparation process of breast milk substitutes requires energy and water. All of this impacts the environment, and feeding 1 million babies with infant formula for 2 years requires approximately 150 million cans of formula. Next. So, some solutions. Sustainable development meets the needs of current generation without compromising future generations. It is an urgent imperative, and we must intensify the conversations, call for more robust research, and engage all relevant sectors to take action. Next, so what can we do? And using the SDGs as a framework for planetary health, we can align national and international policies and guidance on breastfeeding and infant and young child feeding with the SDGs agenda and other environment climate initiatives also. Ensure that a public health perspective is taken to strengthen the baby-friendly hospital initiative and breastfeeding counseling among the general population, including during emergencies. Raise awareness among decision makers to recognize the contribution of breastfeeding to food security and environmental sustainability. Advocate for policies aimed at reducing carbon emissions and from the breast milk substitute industries. Ensure that the International Code of Marketing of Breast Milk Substitutes and relevant WHO resolutions are fully implemented and monitored, as Dr. Morris mentioned in her presentation. And the last one, it will be enact paid family leave and workplace breastfeeding policies based on the ILO Maternity Protection Convention as the minimum standard. Next one, please. So, talking about societal support, what can we do? We can advocate for increased financing, monitoring, and implementation of better policies and interventions to provide families the support for breastfeeding that they need, especially breastfeeding counseling. Inform communities about the impact on formula feeding in the environment using of a variety of communication techniques and influencers. Sensitize journalists and the media to stimulate public debate on the links between breastfeeding and the environment, climate change. This is new. We have to sensitize the media. Allocate resources for additional research on the climate environmental impact of breast milk substitutes. And also collect systematic data on the impact of difference on infant and young child feeding policies and programs in emergency situations, as the one we are living now. Next. So, reinforcing the breastfeeding council as an essential need, we can advocate for all women parents with young children to have access to skilled breastfeeding counseling from health facilities and the communities. Implement the revised baby-friendly hospital initiative guidelines in all health facilities, including private hospitals. That has been a challenge for the whole world. And also allocate resources for community groups to be able to provide basic breastfeeding counseling and other forms of support close to families. Next. So, ongoing support across the first 1,000 days. Advocate for ongoing antenatal and postnatal breastfeeding counseling to sustain optimal breastfeeding. Create a warm chain of support for breastfeeding by identifying key actors and their roles in the first 1,000 days and linking them to each other to have like a continuation of counseling. Engage fathers, partners, and family support to share domestic responsibilities and care for the breastfeeding diet. Join a mother-parent support group and share experiences with others in the community to normalize the practice of breastfeeding. and develop creative ideas for virtual and online activities to engage target audiences in World Breastfeeding Week 2020. Now, during this pandemic, we have been working with this technology. So we have to be more creative. Next. So build knowledge and skills at all levels. Invest in consistent training programs for different levels of health professionals, lactation consultants, community health workers, and lay peer-to-peer supporters. Advocate for placement of appropriately trained and skilled staff at various levels, peer supporters, health professionals, and lactation consultants. Promote scaling up of existing breastfeeding training tools and programs, including online, digital, and e-learning methods, as well as face-to-face clinical and other practical teaching when it is possible. Engage school children, students, youth, and social media influencers to spread awareness of the importance of breastfeeding for planetary health. Next. And leaving no one behind. Let's promote the use of evidence-based international infant and young child feeding guidelines to develop national action plans and communication messages. Ensure that breastfeeding protection, promotion, and support is specifically included in national emergency preparedness and response plans. Inform all health workers, community groups, and the public about the importance of breastfeeding in national and community preparedness plans. Reinforce support for breastfeeding families that targets all members of the family and the community by developing appropriate and consistent communication messages. Emphasize hand expression of breast milk, appropriate use of breast pumps where safe, correct breast milk storage and preparation, cup feeding, techniques to maintain breast milk supply, relactation, and wet nursing. Ensure that donated human milk is available for hospitalized babies who need it through human milk banks or other appropriate community initiatives. Next. So, a sustainable solution for the planet and its people. The warm chain of support creates an enabling environment that empowers all women parents to breastfeed optimally. Together, we can achieve a win-win situation for humans, for humanity, and the planet. Next. WABA has been able to do few ways to celebrate World Breastfeeding Week this year, a special year. So we on the website has a few ways that you can come and participate, like they share on our social media platforms with their breastfeeding experiences and support needed during the COVID-19. We need to know your experiences on that. Your thoughts about the relationship between breastfeeding and environment climate change. ideas do you have? What are your thoughts about it? We need to know. So I would like you to at Breastfeeding Week 20 activities. Could be physical or very activities. Anyway, tune to our World Breastfeeding your question. Participate in the World Breastfeeding Week 2020. Ask me anything. AMA. Participate on that. And follow the World Breastfeeding Week site and social media platforms in Facebook, Twitter, and Instagram. For more activity ideas and updates, please join us. So, as we know, every year, each year, WABA publishes and designs 3 documents on World Breastfeeding Week. Is the action folder, the poster, and the logo. And you can download from the website in 6 different languages. So try and follow up. Thank you.
Thank you so much, Ms. Chavarria, for sharing this information. This was really, really an eye-opening. Thanks for sharing what WABA does. I think it's very recognizable to have this organization working for so many years. You made an interesting note that really, I think, called everyone's attention. You were saying that every year, $302 billion are spent on breast milk substitutes. I think this is a really high figure. Yeah. You also mentioned that 1 million babies in 2 years consume 150 million cans of milk. This is extremely interesting, particularly because you mentioned that the preparation of these canned products require a lot of manufacturing, a lot of packaging, increased methadone, and that also increases the use of energy and water. So thank you so much for that. You made a call for action, and one of your actions actually said that countries should implement the baby-friendly hospital initiative. So that leads very smoothly to our next presentation. Our next presentation is going to be done by the Ministry of Health of Grenada. And it's been done by Ms. Nola Devonish. She's going to share her experience, Grenada's experience in implementing the 10 steps of successful breastfeeding. She's the department manager of the General Hospital in Grenada, and she has been very active in the entire process of implementing this 10 steps in the hospital. Ms. Devonish was part of the team that had to do with the leading process in the hospital, and she's going to share with us now the experience, what it requires, all the implication of implementing these 10 steps. Ms. Devonish, please unmute your microphone and start your presentation. Thank you.
Sister Devonish, they're having problems logging in, and I am Jessie and Pancho Bruno, who would be presenting for Grenada. This initiative was through the commitment of the Ministry of Health Grenada in ensuring that all our babies get a good start off in life. It was implemented because we noticed at the Well Baby Clinic that less children are being exclusively breastfed. Okay, assistance was then sought from PAHO, who gave us technical support. Okay, and the process took approximately 18 to 20 months, and that support was given by PAHO, which made us felt very comfortable. Okay, next slide. Now, the preparation process was tedious, but we never gave up, okay? We engaged both hospital and Ministry of Health Authority to get their commitment towards this breastfeeding initiative. Now, we first developed a breastfeeding committee and which comprised of nurses both at the hospital level, nurses in the community. We got non-governmental organization and the stakeholders like the private hospitals. They too were on board with us. Then we developed a breastfeeding policy, and the breastfeeding policy, it was done among the committee with advice from PAHO. We also started training of all staff, and when we look at the staff, we train both the ancillary staff and the clinical staff, okay? We also were able to train mothers at the antenatal clinic, and then we had to make some adjustments. For example, we had skin to skin before, but it was just initially when the baby was delivered, we gave the mother the baby to hold so that we could cut off the cord. Then the baby was removed, wrapped, and get ready for his vaccines and so on. However, with this new preparation, what would have happened, the skin to skin was initiated for the longer process, which was about an hour. We even started educational programs on the ward via the doctors who had already been trained, because during their training, they did not have breastfeeding education been given. We also went about developing educational materials. So we had a lot of pamphlets. We had, for example, we had little handouts for persons to get, and those handouts and pamphlets and so was being placed throughout the hospital, in the clinics, and other areas, so that persons would be able to identify and read those materials. We go to the next slide. Okay, next slide, please. Now, what we did, we followed the 10 steps, and we had initially we had the first one, but then we got to use the updated 10 steps, which looked at the first area, looked at the critical management procedures in terms of our making sure we had our policy. We paid particular attention to the International Code of Marketing of breast milk substitute, and we were very serious about getting baby-friendly initiatives. So we ensured that these organization who was the agent of the breast milk substitute, we totally got them out of our system. Because like sometimes during the year when we had a first baby being born for the year, we had them come in and give packages, and in the packages, they were putting 1 little tin of the breast milk substitute. So we totally got them out. They were not a part of giving any gifts or present to those newborn mothers, those new mothers. Now, our breastfeeding policy, like I said, we had it developed, and what we did, every department within the hospital, the community, they were given one of those policies. So you could walk into the lab or even to the X-ray department, they had a policy and they knew what we were really vying towards, okay? We also look at our internal monitoring. So we had a person designated who was not members of staff on the ward, but they were members of our breastfeeding committee. They went in and do monitoring at different times. Look at our books where they wrote our statistics. We observed to look at what was going ahead. And anyway that we saw there were shortcomings, we were able to give them a little guidelines in terms of we need to improve and we need to boost on that, okay? In terms of our staff competency, we really worked at it. And in terms of our staff, we didn't just look at our clinical staff. We looked at non-clinical staff in terms of, we went so low as going down to the groundsmen, the orderlies. We wanted to make sure that these persons knew all about breastfeeding. Okay, next slide. Then we follow each of the other steps. And like I mentioned, antenatal information, it was given throughout every one of our clinics throughout Grenada, Caribbean, pretty much. In the past, we used to be doing parent craft teaching, which initiates all about the breastfeeding. But with our initiative, what we did, we went further into it. We made sure that each of the pregnant women who came to the clinic were able to give them more information about breastfeeding. And we take them from the unknown to basic, or from the known to the unknown, okay? We even looked at, which is step 4, at the immediate postnatal care, in terms of when the baby was delivered. They started, for example, doing the skin to skin. make sure that we initiated breastfeeding. We also ensure that it was supported during the breastfeeding. So it's not just ensuring that they had the baby and breastfeeding was not really a part of it, but we really made breastfeeding a part of the process. Now, in terms of supplementation, we ensure that we only gave breast milk to each of the baby that was born. Only those who had medical condition were not given breast milk, but they had to really have a medical condition. There were those babies who had problems sucking or latching. What we ensured, we make sure that these individuals were mothers express. So part of our education and part of our teaching, we had expression of breast milk as an important area so that these mothers would be able to know what to do. Okay, rooming in, we had no problem with rooming in because in our hospital, every baby stayed with their mother. So the mother was definitely right there with them, and it was not an issue. So they were able to respond to feeding. So for example, feeding was on demand. These mothers were even taught how to identify some of the cues for breastfeeding. So they didn't, gone are the days when we used to say breastfeed every 3 hours, but we totally got that out of our system and ensured that the mothers breastfeed on demand. Okay, we ensured that bottles, teats, and pacifier was not part of our daily routine. They were not part of our ward routine. So we ensure that mothers didn't come with it. Even those who had to get supplementary feeding, we tend to give them via the cup, or we use the cup and spoon, okay? So these were some of the ways that we went about it. And one thing that we had for support is the care at discharge. So every individual on going home, they knew exactly who they had to contact. So the nurses at the district level came to maternity ward, take the names of all of the persons within their district who delivered. So when they went home, the nurses knew how to get totally in contact with those individuals. Next slide, please. Now, if the external assessment, this was done after the internal assessment or the readiness was done. And we were a little bit adamant, we were scared, but we went through it. So when the external assessors came, we didn't have an issue. Yes, I said we were anxious, but we persevered to the end. Next slide. Now, the assessment process took different, the assessment procedures looked at differently. We reviewed the material and the hospital statistics was looked at. The breastfeeding policies was even paid attention to. They looked at the training curricula, the outline, all of the records that we had on maternity ward in terms of what time the baby was born, when breastfeeding was initiated, all of those was recorded. We even were able to outline some minimal content in terms of our antenatal education. We had printed materials that was given to mother. We even looked at our breastfeeding statistics, and major thing was paid attention to is the observation in all areas. So even if we would have been saying to the examiners, we were ready, this is things that we had in place. But what we realized, they too paid attention to the observation. Now, next slide, please. So we, in terms, the clinical staff was interviewed. We didn't, or they didn't just interview those on one shift, but they paid attention to the 3 shifts. We had one shift from 7 to 1, we had another shift from 1 to 7, and then we had the 7 to 7. And those clinical staff was interviewed, those who was in the maternity, the special care units, and even the antenatal units. A total of 80 interviews was done in total. Some of the non-clinical staff who interacted with mothers were also interviewed. Yes, so the postnatal mother, even we interviewed those. those who had cesarean, we even also included them, okay? The pregnant mothers, and we maintain confidentiality. Next slide. Now in our findings, go to the next slide. In the findings, what we realized that summary of the study, there were 10 areas, and in Grenada, we failed 2 of the areas. One, the area that we failed in terms of train all healthcare staff in skills necessary to implement this policy, and the area where we encourage breastfeeding on demand. These were 2 areas that we were weak in. And next slide, we were not given the full accreditation, but we were given a certificate of commitment because I thought the external examiners felt that we really tried throughout that era. So they gave us another 3 months to do a reassessment, and eventually when they came, we got through with accreditation. Okay, next slide. And so when they came, after we failed those 2, they made recommendations, and those recommendations were: 1, the uninterpreted skin-to-skin contact for 60 minutes, we had to maintain that. The availability of the HTLV test, because these 2 areas had caused weakened our vie for getting baby friendly. And so we worked on it over the next 3 months, which was in March to July. And in July, when they came, they accredited Grenada. Next slide, please. Okay. You could continue the next slide, because some of them I had already said it. I just didn't want to take up a lot of our time. So we saw in July, we were able to give the breast BHFI or BFHI certification. This is the then CMO receiving that plaque, which is presently at the General Hospital. Next slide, which states in terms of our lesson that we learned. It may have appeared to be long and tedious process, but it worth it because we made it. And another thing that we have to think about, it increased our effectiveness in terms of exclusive breastfeeding. Perseverance, I'll bring that out to all other members who hasn't yet been assessed. Never give up. And it's not just a one-man approach, it has to take a team approach. So therefore, it requires engagement of the highest level of authority. Thank you.
Thank you so much. This was really, really an interesting presentation. We noted it took approximately 2 years for Grenada to get the certification of implementing the 10 steps. And we learned from you that it wasn't an easy process. There were so many things to be put in place. And it's really amazing all the work and effort the hospital put, but it was good to know this outcome. We also would like to take this opportunity to congratulate you on it, because you said that the initial time you had the external assessment, the hospital actually failed, did not pass all the 10 steps. Whereas most people would probably get discouraged and stop. You took it as a motto to continue and scale up your efforts, and finally, you're currently implementing those 10 steps, so thank you again. Now, some may question why all the effort at hospital level when many of the challenges to continue breastfeeding actually happen when the mother leaves the hospital. And this leads us to our next presentation, which is will be facilitated by Ms. Latoya Matthew Duncan. Ms. Matthew Duncan is the Nutrition Surveillance Coordinator at the Ministry of Health in St. Kitts and Nevis, and she will be presenting to us in the next 10 minutes the experience of St. Kitts and Nevis in conducting activities at the community level to promote breastfeeding. Ms. Duncan, please go ahead.
A pleasant good afternoon to everyone. Thank you, Dr. Omia. Allow me to share my slide, please. Thank you. A pleasant good afternoon again to everyone. Kindly allow me to adapt the protocol that was already established earlier. Like Dr. Omia said, my name is Latoya Matthew Duncan. I am the Nutrition Surveillance Coordinator in the Ministry of Health, St. Kitts, and the focal point for BFHI for St. Kitts and Nevis. I'll get into my presentation. The Ministry of Health is moving toward the designation of baby-friendly hospital initiative in 2 major hospitals in St. Kitts and Nevis, the hospitals are the Alexandra Hospital in Nevis and the Joseph Nathaniel Pratt General Hospital in Nevis. Simultaneously, the ministry is strengthening the support to mothers after discharge to continue breastfeeding. The support, protection, and promotion of breastfeeding requires support at the community level and intersectoral approach. And we'll get into some of the activities during my presentation of what the Ministry of Health in St. Kitts and Nevis have been doing. Sorry, but the slide is not moving.
No, it's not.
It's
But
not.
probably you could continue while it's loading, you could continue sharing with us from
Okay,
your
well, I
screen.
do hope that it loads soon. The majority of the slides tend to be more picturesque, so you won't be able to get the full content or appreciation of the presentation without the slides. Okay, now first thing I'm gonna discuss our breastfeeding committee. Who is our breastfeeding committee? Active and past certified governmental organizations, BFI trainers, professional associations, and community groups. Now, the Ministry of Health, in 2018, we had a trainers of trainers BFHI workshop. We had 9 individuals trained as BFHI trainers. 4 were from institutional base and 5 was from the community. Now, these individuals were the first set of persons to make up the breastfeeding committee. So from there, we started organizing breastfeeding committee. Then in April of 2019, we invited other ministries and other government organizations in order to join with us. We sent out quite a bit of emails to all of the community groups that were active, as well as the different ministries, NGOs, to different persons. We did receive a majority of persons did respond to our request. However, most wasn't so much interested in being part of the breastfeeding committee. We had, on the initial meeting, we had 12 persons, other than those from the representative from the Ministry of Health, show up for the meeting. Persons have agreed to be a part of this committee based on their other commitments. We didn't let that stop us. We continue to thrive and we continue to hold meetings every 3 months. The roles and responsibilities was to develop strategies to promote and support and to normalize breastfeeding in St. Kitts and Nevis. Some of the challenges we faced with the committee was lack of commitment by some members, selection of members by organization. For example, if the meeting date was set for, let's assume, August 6 at 2 p.m., some of the organization chose persons who were available to attend this meeting because they received the invitation and not because individuals had an interest in the particular subject areas. So some persons showed up for the first meeting. They did voice their concern that they were not interested in being a part of it. However, while other organizations and did not return to other meetings, some suggested other individuals within their organization who they think would actually be of more assistance. And so we did follow up and get in contact with most of those organizations, most of those individuals, sorry. We also had an issue with the availability of other individuals to attend meetings. So what we started to do, we started to send out the chain emails, and then we would follow up via telephone as it relates to decision makings and different activities. So we did not allow them, the individuals, to stray because they did not show up to a meeting. We would call them via telephone. For example, we'll say, we are thinking of holding this activity at this date. Would you be interested? Do you have any recommendations? And then those persons would usually respond either via email after looking at the email that was shared with them, or they'll share their input directly over the phone. Now, breastfeeding support system. What we have in place as a breastfeeding support system is a pool of numbers from different individuals, some retired nurses, some community members who are actively engaged in breastfeeding. So we have these numbers available at the maternity units, and persons are given these numbers and are allowed to call when they have issues as relates to breastfeeding. The role of the breastfeeding system is to support women before, during, and after childbirth to promote and support continued breastfeeding. So persons are given these numbers and they are encouraged to call. The name of the individuals are also listed in case someone, for example, some of them are retired nurses and somebody might feel more comfortable dialoguing with this particular individual compared to another individual who they are not familiar with. So that is what we have in place for our breastfeeding support system. We do have some scheduling conflicts sometimes because some of the persons for counseling are not available 24/7 like we would hope. However, we do have quite a few dedicated ones who always try to answer their calls. That is what we have in place for our breastfeeding support system. Breastfeeding in the workplace. The Ministry of Health continues to promote breastfeeding in the workforce and will be launching a workplace health and wellness program as part of the SKN Moves initiative. The following 2 criteria, which is solely about breastfeeding, is listed as part of the as part of the initiative for workplace wellness. 1, provide our connect employees to support services or education programs, and 2, provide appropriate place for breastfeeding and breast milk expression. This initiative, here we are now. So this is the Healthy Business Challenge. This is the poster of it, and this will be launched next week as part of the SKN Move activities. Now, most of the rest of the presentation is mostly promotional and awareness activities that were put on by the Ministry of Health, St. Kitts and Nevis, looking at encouraging breastfeeding and trying to normalize breastfeeding in St. Kitts and Nevis. Breastfeeding Week in 2017, we held quite a bit of activities starting from September 3rd and it climaxed on Friday, September 8th. We had church service, for example. We had quite a bit of education sessions. We had them in the institution-based community as well as in the general gathering settings. Wherever there was an already scheduled meeting, if it was a community meeting, a school meeting, we were there during that week. So what we do, we piggybacked on other activities that were already in progress, activities that were scheduled by different organizations to bring about some awareness as it relates to breastfeeding and to let them know the way forward in which the Ministry of Health, St. Kitts and Nevis was looking to take breastfeeding. The climax on the 8th, we had several activities. We also had this one known as Walk and Talk, where we had different individuals in St. Kitts and Nevis would randomly stop persons on the street, ask them questions. For example, what do you know about breastfeeding? And try to develop a dialogue with them. Some was brief, some was lengthy, and then at the end of the session, they were given a sticker to say, I support breastfeeding. That was the climax. The pictures you see here featured our very own Dr. Omea and our BFHI trainers receiving their certificates. So Ministry of Health St. Kitts made the commitment at looking towards becoming baby friendly. So these are some of our nurses, our community nurse and our HP Health Promotion Unit workers who decided to take up the challenge. All of this is looking at hopefully that our CMO will also be able to receive that plaque like Grenada. So we are really, really pushing and hoping that we'll get some support from other individuals to help us to achieve this goal. Now, this other promotional activity in St. Kitts and Nevis during June, the Early Childhood Unit puts on a month of activity known as Childhood Month, Child Month, we like to call it. So we usually piggyback on this activity every year. Leading up from June, we do quite a few sessions within the early childhood education sessions. We go into the schools. We do, other than educational sessions for the teachers, we also invite parents. We answer questions from breastfeeding to different elements as it relates to early childhood nutrition during this period. And then the event is climaxed annually with a march, and we usually take part in that by joining with the school and looking at ways of promoting breastfeeding. If we look at the different pictures, here we have some of our committee members marching along with the school with banners, as well as some of the educational materials that we tend to use to do education for breastfeeding. So we do this annually. It's for the entire month of June, and then we take part actively in the march. We don't just encourage schools to do it, we actively take part. So we march along with the schools, we provide educational sessions for them. We even adapt some of the schools during that period and assist them to get their materials for their march ready. So there we have a picture of that, some pictures. Now, during 2018, we did quite a bit of activities as it looked towards, we were trying to create more education towards the 10th step to get JNF, General Hospital, as well as the Alexandra Hospital baby friendly ready. So our focus in 2018 was everything in preparation. We're looking at being assessed to be designated baby friendly. So what we had, the first thing there, it's an animation for breastfeeding that is known as breast milk is best. So we did an animation looking at the hunger cues and different information as it relates to breastfeeding that we think the general public and breastfeeding mothers should know. We also did a documentary with major health officials, such as the Chief Medical Officer within the Ministry of Health, Permanent Secretary within the Ministry of Health, St. Kitts and Nevis. We had the different individuals, we had nurses, community members all taking part in this documentary, speaking about baby friendly and what they know about breastfeeding, and also highlighting what the 10 steps meant. Along with the documentary, we also developed 10 posters based on the 10 steps, and you can see them there across the screen from 1 go down to 10. And all of these were created using local actors. So everyone you see on the posters is an individual either from St. Kitts and Nevis. Now, this is my, I'm almost finished. I think this is my second to last slide. And we are looking somewhat at some of the promotional activities that we did. But this year, for example, we developed another video, some what persons would call some bits, which is extremely short messages that they fit into different media sources such as YouTube, Facebook, in order to promote social media awareness to get a wider audience. So we had 11 short messages that were developed, and we had different individuals, doctors, nurses, community members, breastfeeding mothers, teachers, all had different messages to say. Even a child as relates to breastfeeding, the messages were very clear and short. I'm hoping that we'll be given an opportunity to share it with you. If not a little later, we can probably send it via email so that you can get a look at what this video actually is like. We also developed some posters about breastfeeding and COVID-19, and on the screen you can see 3 of them present. Breastfeeding with COVID-19, COVID-19 and breastfeeding, and COVID-19 and breastfeeding. So those are some of the posters that we developed. We also developed and mounted a few, we developed and mounted a few billboards also in St. Kitts. We have 6 billboards already up in St. Kitts, and on the bottom, the last 2 pictures you see, that is one of the billboards already installed, and the 6th image, that's another billboard that will be installed. So these are some of the promotional activities that we have been doing in order to create some awareness in St. Kitts and Nevis, looking at breastfeeding and helping the public to realize that breastfeeding should be something natural and it should be a norm within St. Kitts and Nevis, and not something that persons want to edge away from or shy away from. And that is not only the role of a woman, but it's also the role, they also need to have a support. In conclusion, the Ministry of Health in St. Kitts and Nevis is committed to protecting, promoting, and supporting breastfeeding through advocacy and implementation of the 10 steps to successful breastfeeding. Thank you.
Thank you so much, Ms. Latoya. This was really very, very impressive, particularly for us that have been involved in developing campaigns and community work. We know it implies a lot of organization and commitment, and we heard your challenges, but we really encourage you on this because, as I said before, the community part is sometimes missing when we do baby-friendly hospital initiatives. We need to complement it with the community interventions. So now we are reaching to the part that we wanted to actually, when we promote breastfeeding, sometimes we need to relate to the person who is actually breastfeeding. And for this, we have a testimony of a mother who wanted to share her story with us. This is Miss Denisha Grant. So I asking to please, Miss Denisha to please put up her video so we could hear of her experience in breastfeeding.
My name is Denisha Grant. I'm from the community of Sandy Point. I am a mother of two boys. Joshua, he's 7 years old, and Jeremiah, which is 7 months old. I am a single mom. For me, it takes oneself to encourage themselves in breastfeeding because it's a really hard practice, especially if you're a mother that doesn't have help, one, and lives in a home by themselves. Some of my challenges in breastfeeding were low supply of breast milk. Sometimes I'm panicking because he would take like 4 or 5 bottles of 4-ounce milk. And I work at the health center. I hardly have time to even eat my lunch. So I would sneak away, express, because we say breastfeeding is not just about the breast. You could express and you could give from a bottle. So I would breastfeed him when I have the time, or put it in a bottle, give it to the sitter, hold the syringe up, give it to him. One of my other challenges were sore nipples. Oh my God, sore nipples. Because I'm stressed out, because I'm tired, I have to deal with clients and I have to go home. My nipples are sore to all. Another challenge was, as I said before, was exhaustion. I'm really tired at the end of the day as a single mother. I have to just organize. So I have a schedule. When do I breastfeed? When do I put him to sleep? When do I express? When I deal with my toddler? When do I wash? When do I cook? So it's personal. You have to want it to do it. Another one of my challenges was society. Why are you giving the baby breast milk till now, the child in 4 months? Put some calm up in the child mouth, put some formula in it, give him some juice, and I'll be like, it's my choice. I want to give him breast milk because at the end of the day, there's a goal I want to meet. So if you don't have the encouragement, you personally have to do it. Another challenge for me was sadness and depression. I'm in a home by myself, baby crying, toddler nagging. Of course, no production coming out because I'm stressed. I overcome my concern and issues about breastfeeding in COVID-19 by using COVID-19 protocols. So I would go home because I'm at the health center based. We don't put clothes and then go in the health center and change the uniform. So I'm usually in my uniform. So I go home, I shower, I use my COVID-19 protocols by using the hand sanitizers, the mask. I just want to encourage mothers in seeing kids, especially mothers that are economically struggling. Just the first 6 months, it's just the first 6 months, we're going to do exclusively breastfeeding. We're going to do it. We're going to do it and we're going to do it. Let nobody discourage you from breastfeeding. Don't get me wrong, it's a challenge. It's a fight, but it can work. It can really work. Whether you're giving from a bottle, a syringe, a cup, a spoon, it works. If you don't want to do it for yourself, do it for the kid's future. You can tell yourself a breastfed baby is one of the most intelligent human. I would just like to wish all mothers around the globe a happy breastfeeding week.
Thank you so much, Miss Denisha, for sharing that story with us. I am sure many mothers that are listening to us today can relate to Miss Denisha's story. I mean, it's really for us that have breastfed, we know it's a really personal commitment. And we do have a lot of challenges. And Miss Denisha spoke about not having support. And that leads us to our other testimony, which is provided by Mr. Ian. He's going to share us how he, as a father supported his wife in breastfeeding. Please, Mr. Ian, go ahead.
Being a father of a premature baby was very challenging in the sense that you would have seen last two children being delivered by natural childbirth, and to see your third child being delivered by cesarean section, and having a low birth weight of only 2 pounds 7 ounces, 1,240 grams. It was challenging because then to being rushed straight into an incubator and then to the neonatal intensive care unit. It was a very challenging and scary time. Because our daughter Haley was in an incubator. Obviously, getting milk directly from her mother's breast was not an option. So what we would have done, we would have expressed the breast milk during the course of the day, also in the evening, that at her feeding times, which was usually by a tube, the initial stage down her trachea, that she would always have fresh belly breast milk at every feeding. Well, the challenges were that my wife having a cesarean section, it was very difficult for her in her mobility. So I would have had to step in and help express the breast milk, make sure it got to the hospital on time for both the morning and evening feedings. We also have 2 other children, so we had to make sure that they were at school during the day, and in the evening when we visited, we had to make sure someone had to take care of them. So from that point of view, you know, it was very stressful worrying about the baby being premature. You were worrying about your wife, you were worrying about the other children. So from that regard, it was very challenging, and also making sure that the breast milk was there, that she could have regular feedings from a natural source. I know that breast milk was beneficial because we saw that she would have gained weight in a very consistent way. Her growth chart in terms of over that period of 1 month while she was in the neonatal intensive care unit, we saw her gain weight. We saw her blood platelets and all her different functions improve from when she was born. And we saw that there were no complications in terms of infections, and she was able to be released from the hospital uneventful, having no complications. And I would definitely recommend breastfeeding for parents, whether the baby is premature or whether it's full term, because that natural source of that the mother's milk contains the right mixture of minerals, vitamins, and also antibodies that is conducive to the health and the well-being of a young child. And doing it to at least for 6 months into the child's development, or even a little longer, certainly beneficial for the child and their future development.
Thank you so much, Mr. Ian. This was really, really an impressive story because you can see these challenging circumstances in which this happened, and we just wonder How would your wife have coped if you were not there to help with the children, to help her express, to take the milk to the neonatal intensive care unit? And I guess the call from your messages, from your video, from your story, is for men to get involved in supporting their partner in breastfeeding, because we learned from the two testimonies that having support makes a difference. So now I'm going to open, if we have any questions, any concerns. There are, I'm seeing a question that was given to Grenada, but they responded. The question was asking if Grenada saw any difference in their statistics in terms of the percentage of babies living exclusively breastfed. And Grenada responded actually that yes, they saw a lot of improvement. And even with the skin to skin, she saw a lot of advantages. And there's also a congratulation to Miss Tanisha for sharing her story as a single mother, struggling mother with 2 children, how she had to stand up real strong to her commitment to breastfeeding. Do we have any other questions? Any other? I'm not seeing any hands up. I think the whole topic of breastfeeding was very, very well addressed in this meeting. I'm not sure if we should wait a bit more for questions or move to Dr. Lawrence's comments. Maybe we could move to Dr. Lawrence's comments, and should any question, because I'm not seeing any more. Brenda, are you seeing any, or it's just me?
Yes, please. I can read a question for you, Dr.
Okay,
Omir.
please. Okay, please.
Okay. It says, good day. Any advice for feelings of guilt for mom who can't express enough milk?
Now, we're not sure if Miss Denisha is connected still, but she actually related in her story that she had that problem and what she had to, you know, make a schedule and get herself organized. But I could definitely understand that. And I think that's the whole issue of what we were trying to say, you know. Sometimes we talk about promoting breastfeeding, but we really have to look at it from the mother that's breastfeeding and all the challenges that this imply. And obviously, from a mother that breastfed, which myself, I know sometimes you have that guilt, you know, because, and many times it's just stress. The stress has a lot to do with it. But yes, we definitely understand that may make things even worse. And the encouragement there is to not, you know, we have techniques that we teach in the health facilities for mothers to increase the production of milk, which is the stimulation. And yeah, do you have another question, Brenda?
Please. What medical conditions can affect the amount of milk a mother produces?
This is a very interesting question. Dr. Audrey, do you want to take this question?
I'm not sure right now I can list the medical conditions of the birth that affect the amount of milk. But what I would say is that very often it is not due to medical conditions. Very often it is because of mother's state of mind, nervousness, she's not comfortable, issues like those, and also the positioning and attachment. So very often, when a mother might think that there is an issue, something is wrong, it may be that she is not positioned right, and importantly, she's not whether breastfeeding or expressing frequently enough, because the frequency has a lot to do with the amount of milk, making more milk. So that's what I would say.
May I add to this, Darlene, Dr. Omir?
Sure, please go ahead. Please go ahead.
I think it's a very good question. What was answered is very important. And also, earlier, the lady, Miss Grant, also mentioned if you have certain worries, definitely that would be contributing. Also, Mr. Ian Moore, from his discussion, one of the conditions, medical conditions, is premature birth. Because at that point in time, the mother is not ready to produce the necessary amount of milk. And then just to add to that, maternal obesity would also be another factor. If the mother also during her pregnancy, if she has preeclampsia or eclampsia, that is high blood pressure induced during pregnancy, that contributes to lower production of breast milk. And then diabetes is another factor, so from medical conditions. So overall, to produce milk, maternal milk, the breast has to be, the baby has to be put on latched frequently, and then continue to breastfeed regardless of the amount produced. So that would continue the mother to produce more milk. And then if the baby is unable to suck or for some reason or another, to continue to have that, and then often to the baby to be fed every 2 to 3 hours. That will also produce more milk. So to be alert also the feeding problems with the baby. It's not necessarily the mother was unable to produce. Sometimes the baby was not suckling properly, and then making available the milk. So it's very good to have also lactating nurses to educate the mothers, and as much as possible, the mother have to be prepared. That's what the program in St. Kitts have done as well. Last but not least, if the mother is also taking any kind of medications, that have to be looked at. Back to you. Thank you.
Thank you so much for that additional clarification. Do we have more questions, Brenda?
Yes, we have a comment and a question. The comment, which I, 2 questions and a comment, which I am sure we all agree with. Thank you for sharing, especially to Denisha and Ian. We certainly need to hear more of these stories. Question, what steps have been made to redeveloping policies in workplaces so mothers can express milk at work? And the next question, congratulations to Grenada on achieving BFHI accreditation. Does the accreditation extend to all hospitals in Grenada, public and private, or only the general hospital?
If I'm going to answer for Grenada, it was only given to one of our public hospitals. We have 2 other subsidiary hospitals, they're not yet accredited, and we have 1 private hospital, they're not yet. So basically, it's our 1 general hospital that has been accredited.
Regarding the breastfeeding in the workplace, we heard the experience from St. Kitts and Nevis. They're actually launching an initiative, I believe she said next month. And I think this is one of the areas that we probably need to work more on. I know there's a lot of advocacy work doing on this, and there are some private sectors. Recently in Barbados, I believe it was Flo that launched an initiative to support breastfeeding mothers. But I think this is one of the areas that probably needs to be worked on more to ensure an homogeneity procedures, practices in the various institutions and organizations.
May I also respond?
Sure.
Right. As a matter of fact, that was one of the areas that we focused on for World Breastfeeding Week last year in terms of it was a part of the maternity protection as well, but also for workplaces to be more breastfeeding friendly. So they're having a couple of World Breastfeeding Week observations that have looked at that, but that's going to be done on a country by country basis. So whilst we can carry out advocacy, we can advocate for, the countries to put the laws in place, and also for workplaces on their own to make the arrangements for their workers. But each country has to take this up, and also you can have, as members of the public, as civil society, as healthcare workers, you can also advocate for that. And once there's a groundswell of support and a request for that, then it is more likely to happen.
Thank you so much for that. Yes, yeah, definitely that's an area that we need to do a lot of advocacy on. Brenda, do you want to give us the last question?
Sure. There are two questions that are the same. Thank you for these informative presentations. Will participants/attendees receive CE credits?
Yeah, I would need to do an internal analysis to see if that's an option. And if it's an option, definitely that's a possibility, yes. Okay, so now, okay, thank you so much. Now I'm going to pass to our to my colleague, Dr. Patrice Lawrence Williams. She's going to wrap up our session and give the closing remarks.
Thank you, Dr. Amir. We had a great meeting and fantastic contributions from the country. So therefore, on behalf of the PAHO WHO representative, Dr. Yutalis Gibre, the organizing committee and the team at the PAHO Barbados and Eastern Caribbean office, we'd like to express our appreciation to all our speakers in this afternoon's webinar, our expert presenters, Dr. Audrey Morris and Ms. Irma Shabira de Maza, our country presenters, Ms. Nola Devonish and Mr. Toya Matthew Duncan, Ms. Denisha Grant and Mr. Ian Moore, who highlighted their experience and we really learned from them, and our most able moderator, Dr. Darlene Omir. We are all familiar with the slogan that originated at least about 50 years ago as a part of a public health campaign, breast is best. And after hearing today's discussion, we too can attest that breast is best. So let us continue to echo and support the call to action to support breastfeeding. Thank you. Over.
So thank you all, and we hope to see you again in future webinars. Have a nice day, and thank you.